Hanna Nohynek, MD, PhD, Chief Physician at the Finnish Institute for Health and Welfare, Helsinki, Finland. And today I'm going to discuss general issues on vaccinations and also the local ImmuHubs in Finland. In Finland, the number of foreign citizens or people with ethnic backgrounds is not very high. However, their numbers have been increasing, and then certainly we here at the Public Health Institute are very much interested in understanding on whether there are differences in the knowledge and attitudes and practices among people with different ethnic and language backgrounds regarding their vaccination status and their willingness to take vaccines. For example, we know right now that in the Somali population in Finland, the uptake of the measles, mumps, or rubella vaccines is actually higher than those living in those with the Finnish backgrounds. During the past 2 years, we've been struggling with COVID, and also we are studying on how different people have been taking the COVID vaccines. So in that landscape, I'm very glad to introduce to you that in Finland we have planned 3 local ImmuHub project sites. And these are for people who are isolated or difficult to reach and vulnerable populations, and we aim to increase vaccine uptake among these groups. The first project is with undocumented migrants living in Finland. Some people have called them paperless, but really we call them undocumented migrants. Since the undocumented persons, they have no legal status as to reside in the country, and it's difficult for them to access the regular health services, we have decided to establish a partnership with the local non-governmental organization which provides health services to these groups of people. And we will be running the ImmuHubs project in collaboration with them. At this moment, the clinic does not provide any vaccine services to these undocumented persons, but we want to have knowledge on immunization status and barriers to immunization services after the ImmuHubs project, so that maybe one day also the undocumented people could receive vaccines in this particular center. On the second ImmuHub project, this is with the older migrants in Helsinki. Again, we're collaborating with the NGO called JADE Toimintakeskus, and that's targeted to older migrant persons age 50 years and above in the Helsinki region. Older migrant persons in general, they have limited activity as compared to younger persons, and the main aim of the group activities in this JADE-keskus is to prevent the challenges posed by aging and to promote the inclusion and empowerment and overall well-being of older people. JADE is a diverse and a multilingual community of seniors from very diverse backgrounds and life situations. It helps to bring together the older foreign language speakers who might have difficulties to take part in organizational activities, specifically for older people in their own mother tongue. And actually in JADE, the activities are carried out in Somali, in Arabic, in Mandarin Chinese, in Kurdish, in Farsi, and Darin, and Finnish. So it really is a very diverse group. And the new language groups will be set up according to the need. And in our ImmuHub project, we will ask the older migrant persons about their knowledge and their attitude and practices regarding general vaccination practices and make them aware about their vaccination status, and then we'll tell them where they can go and get their vaccines if they are not up to date. Of course, we'll also discuss with them what the vaccine preventable diseases are to increase their knowledge. And then we are still discussing what the third ImmuHub in Finland will be. We had originally planned to include persons from Somali second generation background. However, due to the COVID pandemic and the current political situation, that has not been an easy thing to do. And we're thinking of alternatives, which might be on talking with the Roma people, who is a very old minority group in Finland, who also have their own attitudes and ideas about vaccination. So that might be another additional ImmuHubs. So how can you help? Well, first, stay up to date with your own and your family's vaccination to make sure that you're protected against the different vaccine preventable diseases. And you can stay informed, keeping an eye on the ImmuHubs and the social media channels. And second, spread the word about what the ImmuHubs are, both in Finland but also in the other European Union countries that are involved. And third, use the tools available to you. If you don't know where to start, you can use the ImmuHubs Vivi vaccine application, which will be the tool to determine the aspects of your vaccination status if you're unsure about it. And medical professionals and students, they can also access education knowledge of the free immunization SEKI platform. And there is an educational framework for healthcare providers and medical students. And finally, if you belong to one of these groups that we discussed up above, if you are an undocumented migrant, if you are an elderly person, if you are a Roma population, Somali population person, please come and join us in one of these Finnish ImmuHubs. You can get more information from the THL website, thl.fi, or from the ImmuHubs website on immuhubs.eu. Looking forward to working with you all. Stay healthy. Bye.